Welcome to Nurse Practitioners Changing Practice. I'm Carol Berger,
Hi, I'm Nina Zimmerman.
and we are so happy to have Dr. Kern with us today. Welcome, Dr. Kern.
Hello.
Hi, thanks for being here, Joanne.
Thank you for inviting me.
So Dr. Kern, you had like 20 plus years experience as an NP, right? 40 years.
But I look incredibly young, don't I?
Yes,
You do. You really do.
You do. And so, I mean, you've got so much experience, and you've come now to, I guess, how long have you been at Maryville? About 7 or 8 years now, where you've been teaching the adult Gero program.
Yes, I actually started as a half-time employee in 2013 after I finished my doctoral education, but I continued to practice as an NP full-time at that point. And then I transitioned over to taking on the role where I am now.
And now you are like the program coordinator for the entire adult Gero program. So that's amazing.
I'm the coordinator of the adult Gero primary care nurse practitioner program. Yeah, so it is very exciting. Considering when I started my career, I never thought I would be in this position. So yeah.
So tell us a little bit. Oh, I'm sorry.
Yeah. No, it's okay. Joanne, Dr. Kern, talk to us about your journey as an, it's okay to call you Joanne. Okay.
Sure.
Joanne, talk to us about your journey from going into nursing, and then your nurse practitioner, and then you got to talk about your choice for a doctoral program. You got to talk about that.
Okay, so I'm not. I'm a little. In case you couldn't figure out, I'm a little bit older than the brand new out of high school students. But when I was many years ago, when I've always known I wanted to be a nurse. So since I was very young, 7 years old. Which I was very fortunate, my sister tells me, because most people don't know what they want to do in life. So my goal was to get out of school and be a nurse. So I went to the traditional diploma school, which was DePaul Nursing School way back when, and actually was the last graduating class from that. And my goal was to be a nurse and take care of patients. That's all I wanted to do. I thought people who had degrees were people who just knew how to teach but didn't know anything about actually doing the nursing part of it.
The job.
So wow, has things changed. So I was an RN for a long time, and then I decided to go back I guess it's about every 10 years I decide to go back to school. So I went back and did the Maryville weekend nursing program for my BSN. And because my goal was going to be in a different direction, I thought maybe I would go to pre-med, because I was, 28 years old about that time. But, and then it was at a point in my career where I thought, do I really want to do that? Or I love nursing. And so I thought, well, I just kind of was throwing it back and forth. I did take pre-med courses. So it was, you really have to work at that. And so I decided that I thought I was going to either be a PA or an NP. And I knew that I really loved nursing. So I went into Jewish College of Allied Health back then. And I got my master's, and my nurse practitioner, adult nurse practitioner. At that time, there weren't that many different certifications.
Subspecialties, yeah.
There weren't all the subspecialties. I worked in primary. I worked in an office setting. I worked in an acute care setting. I kind of did it all. And so I loved it. I love it still. So it's just the knowledge that, over the years that I have come to love. I've always believed that you're never too old to learn. So no matter what I was doing, I was always taking courses to learn about different stuff totally away from where I would be working, so that I could still be a well-rounded person, mostly because, as you all know, when you become nurse practitioners, you get the phone call, I have this problem. What do you think is going on? So I wanted to be able to help people no matter what.
Yeah,
so
you didn't want to just stay in your specialty. You wanted to be really well-rounded.
Absolutely. Absolutely. And I was fortunate enough to have just a really good support system as far as all the different physicians I've worked with through the years. I gained respect from physicians, which I take very, I I think that's really important for nurse practitioners, for us to be able to have respect from physicians, because that way they don't feel so threatened by us.
Right.
And so we
I
can
think I
continue
have
to
that
build.
same, yeah, I know it. When you can pick up the phone and you can call a number of physicians and say, hey, what do you think about this? And they
Right.
treat you in a more of a collegial way, makes a tremendous difference.
Absolutely. Absolutely. So I thought that was the end of it. I thought that would be my career, but I always knew in the back of my mind, I wanted to teach. I mean, in nursing, we always teach, but I knew I wanted to get in the minds of the new nursing students and new nurse practitioner students, because I wanted to make sure that there were some things that I saw in practice that I thought were seriously missing. And one of those was, yes, we educate patients, but I would be on the floor, or I'd be in somebody's room, or listening to a physician talk to a patient, and they would be just like, blah, 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 with all these medical terms. And then you'd look at the patient's eyes and they were just like,
They're completely lost.
and they had no idea. And so my job was always to go in and say, look, this is the way it is, and talk to them in lay terms. So I saw a real need for people to really learn that technique. So many times we just figure everybody understands everything.
Yeah.
And we also classify people. I think what I find, people just assume that, if you're a college graduate, that you're going to understand everything, or and they assume that somebody who may be homeless or have maybe not as nice a clothes or whatever, they assume they don't understand.
They don't
and that's not the case. I mean, you get hit with a new diagnosis, you don't understand it. I don't care what college degree you have. I don't care. I mean, I can, I remember talking to people who had brain tumors, who were, PhDs, and they were just like clueless, obviously. So I wanted to bring that to new nurse practitioner students, to really point out that you can't just say, do you have any, when they ask questions for the assessment, they'll say, so are you having any vertigo? Are you having any, hypertension?
They don't even know.
Even hypertension, simple things like that. Some people don't understand those terms.
What those terms are.
And so I wanted to really embrace the students so that they would learn that that's really important, because one thing I absolutely, and see, you can tell this is my passion. One thing I absolutely hate is to hear somebody say a non-compliant patient.
Me too.
I hate it.
I mean,
now, granted, we've had, all of us in our careers can say there are patients that are really problems, but why are they non-compliant? I don't like that. I like non-adherent, and I don't understand. And non-adherent, why? They not understand. I mean, there is a great video on health literacy about people who, they don't take their blood pressure medicine because they're told they have hypertension. They think it's going to make them hyper. They don't understand to bring their blood pressure down. So those are kind of things
or maybe this is just not something in their lifestyle they really want to embrace right now. I mean, how many times you go to a provider and they say, well, you're overweight, you need to lose so much weight. And of course, if we don't make that objective, we're non-compliant. But maybe that's not where, maybe our life just isn't at that place where that's a priority for us. So I like that approach.
I just think that to find out why they're not doing something. Now, granted, how many times we've talked to people who smoke. I mean, I used to love it when people would come in and in a neurosurgery practice, mind you, and you would say, you have to stop smoking because it's really bad on your spine and it causes degenerative process. And they would go, oh my gosh, are you kidding me? And I'm like, what? Cancer, lung disease, heart disease didn't scare you, but arthritis does?
Yeah. That's amazing.
So it's, I just find that you're right. It's the time of the patient, the readiness for the patient to accept information. But I also believe that a lot of times they have no idea what they're doing
and what the patient's going through.
What is going on with their life? A prime example. I mean, I had a knee issue and I was going to go get some stem cells, and I'm like, okay, and then I'm like, don't have a clue what you're going to do, and here I am in the business. So they just
Right.
assumed that I knew everything that was going on. And so you should always assume that people don't understand so that
Right.
Right.
you all don't miss those who really don't.
And
And
getting
I,
that patient's story. I
huh?
mean, that patient, getting the patient's
Right.
story, the why and the what's going on in their life. How do you know that that patient's not dealing with a child with cancer or
Right.
dealing with, a husband who's dying, or what's going on in their life? You need to build that relationship enough to understand the whys behind maybe their reasons. Is it an understanding problem? Is it not the right time that they can tackle that problem?
Right.
Or what is it? And I think nurses especially do that so much better, because we're trained in doing that from the first. That's what brought us into nursing.
Right. And I think the thing of it is that what I find is that people get so into, and I even, I'm sure as nurse practitioner students, you're like overwhelmed. How am I ever going to get all this information and everything? And it's a matter of when you're doing your assessment and when you're talking to the patient that you're finding this out. It's not that you're sitting there and going, one of my big, my pet peeve is, oh, well, this person I know has carpal tunnel, or let's say carpal tunnel syndrome. So they skip
Mhm.
over everything in the assessment,
Nope.
and then
Nope.
they
Yep.
miss something horrible,
Right. Gotta go through the
so
steps.
they have to go through the steps, but you have to be able to talk to them. Now, that doesn't mean you have to spend 3 hours in there, because I've heard some people have a hard time managing time, but it is important that, not to automatically label somebody as non-compliant. I mean, if I see that, I just want to,
Yeah.
Yeah. And the partnership piece, you have to find out where the patient's at, and it's a partnership. I'm really concerned, that's what I always say. I'm really concerned about your whatever, smoking, drinking, weight, can we talk about this? Or, where are you at? Would you, can we talk about steps to make that better or improve that? And my patients will say, no, I'm not ready. Or, yeah, okay. It's really important to assess where they're at and why they don't understand, because you just hit it right on the head. And that partnership and that relationship and that very keen assessment is so important.
Well, and I think the other thing is people, we all have had this experience where people come in and all they want is, they want a quick fix, give me some pills and I'm out of here. And, I just, some people, and I've had experience in family, problems where physicians have given patients, somebody Xanax for long term without having any documentation. And it was just because they just wanted it, and those kind of things just almost put me over the edge. Because
so you really are in this, and you're really making a difference because you're helping the students you teach every day.
Well, and I love it when they say, like when you do those one-on-ones or something, and somebody will say, so how's your appetite? Oh, good. And I'm like, no, you have to say, what did you eat today? Because what I think is a good appetite may not, it's not the same thing. So it's teasing that information out. And I hope, that's why I went back and got my doctorates and became in the position I'm in now.
Talk about the doctorate piece. Joanne has a DNP and PhD. Talk about that process of you figuring out that you wanted to do that and
you wanted
what
both.
The difference is. Yeah, talk about that.
So it was as I said, I go back to school every 10 years. So, and I'm a firm believer you're never too old to go back to school. So if you put the numbers together and figure out how long I've been a nurse and how long I've been a nurse practitioner, you can tell I went back older. So I knew I wanted to go back and get a doctorate. I got to a point where I knew that I wanted to not be on call every day of the week and and I wanted to go into the teaching end of it. But I didn't know which way to go. And so it came across, and it was just a unique situation where the program came up where there was a combination DNP Ph.D. program.
Oh, wow.
And I thought, this is perfect, because I can do both, which a lot I people told me I was crazy.
I could see that.
But what it was, and I thought it was a wonderful idea at the time, although living through it was total I won't use the word. But the DNP helps you with the practice change. And then the PhD is where you can take that and build on that research and build the research on it. So I thought it was a good stepping stone, and it was very fortunate for me to end up with both. And my DNP project was on health literacy in the elderly population, because I love older people. In fact, my chair of my PhD used to say, "You and your old people, you just love them." And because I think they're the forgotten generation, as far as, especially when it comes to, all the technology now. I mean, when I did my DNP project and my PhD project, it was before telemedicine was really big, obviously way before COVID. And at that time, they didn't even understand how you electronically send a prescription.
That's
So and so they wouldn't pick up prescriptions because they figured that, well, he told me he was going to give me a prescription, but they
But I
didn't
get one.
So
Right.
they never picked it up. And so I think now my concern is that with telemedicine, that we're losing that part of that. There's still that technology gap there, because I mean, I'm sure it's young people who are always on their phones and everything, but you take an 85, 90-year-old who's used to wanting to hear information from their provider, and now you're saying, I'm going to call you and do this. It just kind of worries me that what's going on there. So
Well, telemedicine has really changed things, and it's for the older generation. I worry, just like you, that they don't have the nonverbal cues, and there's going to be it's going to come more on the provider to draw out that information, because the patient's not right in front of them.
Right. And I hope that the telemedicine that they continue using. I mean, it's convenient, obviously, don't get me wrong. I just hope that the providers remember that health literacy part of it, that
it's really important, because I've been working with a friend of ours, recently, who's an older person and kind of not 100%, mentally sharp, as when you get older, and diabetic, and gets insulin in the mail and had no idea how to even inject himself. So, I mean, just really kind of scary there. And,
well, and I actually had my mother, my 91-year-old mother, at the pharmacy during the COVID thing, trying to get her vaccine. And there was a gentleman in there, and I just almost, he had a telemedicine phone call, and they ordered him a glucometer or gluconometer, whatever. And he picked it up from the pharmacy, and he was back in there the next day because nobody told him how to use it.
Oh,
right.
Terrible.
And I was like, so yeah, I for all you new nurse practitioners, just remember, talk to your patient. That's what I have to say.
That's right.
That's my
what do you tell when you first get that class in? What do you try to tell them about what they're getting into?
Well, I think, first of all, if what I tell students is that you need to really stop and think about who you're talking to. I mean, I show them a health literacy video right off the bat, because I want them to know where they're going through. I tell them that it's a great profession. It is an absolutely great profession. But if you're in it to make money,
No.
you might, yeah. I
Yeah,
mean,
you'll make some money.
That's true.
Your hours. Your hours are
fortunate.
not your own anymore. I mean,
Right.
You're not going to have that 9-hour or 12-hour day. It can be a lot longer.
Well, and I also tell them that they're moving into a role where they are now the responsible person.
Yeah.
So it is upon themselves to continue to learn. I mean, the guidelines are constantly changing. We can teach them what's out there now, but it could be totally different in a year, especially diabetes. Look at all the stuff that's come out. I mean, when I was in school, it was insulin, and that was about it.
Right.
So but
using your resources up to date. I mean, keeping yourself going to conferences, all
right,
important.
and always continuing to learn, because if you get stagnant, then you're going to hurt somebody, or you're gonna, you're not doing yourself any favors.
Right.
So, and I also tell them to, if they're lucky enough to find a niche, then in a practice, then that can take them in different directions. So
That's wonderful. Dr. Kern, what parting advice can you tell nurse practitioner students?
I think it's a wonderful career. Just, if you want respect, you have to continue to learn, if you want respect from providers, I should say, not so much that I'm saying you need, it's if you want physicians and colleagues to, interact with you in a respectful way, take the on yourself to really learn what you can, and always ask for help. Don't be afraid to
Ask for help. Know
If
what
you
you know
don't
and know
know,
what you don't know.
That's right.
I think that's the one thing that I loved is how collegial physicians are with each other too. They'll pick up the phone and they'll talk to each other and say, hey, I got this patient. What would you, and kind of get some curbside advice on something. And I think we need to remember that. And like you said, develop our skills enough that we're not feeling like we don't have the right knowledge to ask the questions.
Right.
Yeah, I think one parting word I would say is, as an RN, how they always say we eat our young. But as a nurse practitioner, I think you try to build up everybody, because it's our career, it's our role in the healthcare profession that we want respect. So we want everyone to do a good job so that we are respected as a provider.
Yes.
I love that.
Well, thank you, Dr. Kern. Thank you, Joanne.
They are so lucky to have you.
And, yes, they are.
As with all
and the students love you.
Oh, yes.
Yes, they do. And we'll probably have you on again to talk more about your pearls of wisdom. So thank you for joining us. And for those of you listening, you can listen to the podcast. You can come to the YouTube channel. It's npschangingpractice.com. Also, we have games and tools there to help you learn on your journey to becoming an NP. See you next week. Bye,
Thanks.
everybody.
Bye.
Bye. Thank you for having me.